Golden Care Solutions is a nationwide medical practice that collaborates with other medical groups. We provide turnkey solutions that make organizations more efficient and profitable, while supporting their clinicians that are providing the ongoing direct care of their patients. Our turnkey care coordination and revenue generation programs and services will reduce your provider and staff workload, allow your providers more time to practice medicine, improve patient outcomes, reduce overall care expenses while increasing your profit margins. You do not pay for our services. Just like any other practice, we get paid directly from the carriers. So everything we do is a profit center for your organization, and as a bonus, most patients love our services. Some of the ways we accomplish this are by building upon basic services like the annual wellness visit, remote patient monitoring, and chronic care management. It takes most practices the same amount of time to provide an AWV as it does 3 regular office visits. Every patient that is not completed is a missed opportunity to provide needed services and improve the patient's care. GCS achieves management and insurance carrier objectives without putting the additional burden on your providers and staff. All our processes and services are comprehensive, aside from the basic Medicare AWV requirements. Our services engage patients to participate in their treatment plans, actively work on care goals, and manage their schedules for care. An example of some additional objectives we've been asked to assist with are improve AWV and quality measure completion rates while reducing the time to provide them. Assist in getting medical records updated in our EMR. Improve patient engagement and compliance with office visits, labs, and treatment plan adherence. Reduce the time that providers and staff spend on patient-related non-clinical work. Reduce care gaps, liabilities, and potential crisis care episodes. Reduce burdens to complete time-consuming low or non-reimbursing tasks or services. Increase patient engagement and awareness of ancillary services and programs. Improve quality metrics, coding, and documentation. Manage the scheduling of patients for follow-up visits and ensure labs, vaccinations, or other screening data is in their medical records before the visits take place. Unlike most RPM and CCM programs where the vendors make 3 times as much profit as you do, with GCS you have no out-of-pocket expenses, medical, legal, financial liability, or responsibility, and you get paid well with no risk. We fully manage every aspect of the programs with patient-focused engagement, designed to help educate patients on their care, increase treatment plan and care goal adherence, ensure labs, screenings, and other services are being completed and available to you during patient encounters. Working with us is pretty simple and straightforward. We analyze patient data and use it to determine which patients are eligible for services and provide you with the expected clinical and financial outcomes. If you like what you see and want to engage us, we get to work. We handle 100% of the outreach and scheduling. We explain everything to the patient. We complete our work, we provide you results, while you continue with business as usual, and your patients always remain under your continued care. We took a random sampling of 10,000 patients from different practice groups operating with an average profit margin of 15%. Half were in our collaborative program. Half were in our fully managed program. On average, their traditional office visit profit is $72 per hour. Because of the time involved, their AWV profit is only $30 an hour. Their average profit from chronic care management and remote patient monitoring averaged $36 per patient per year. Average AWV profit was $23 per patient. Year 1, we increased AWV completion by over 160% and CCM engagement by over 500%. In our collaborative program, where we completed most of the AWV and turned them over to the practice to finalize, we increased their overall AWV profits by over 800%. We increased their overall RPM-CCM profits by over 3,000%, increasing their net profit by over $1 million. In our fully managed program, where we completed 100% of their AWVs, we increased AWV profits by over 1,400%, increasing overall profit by over $1.2 million while reducing their clinical workload by over 2,200 hours. The reason why this collaborative relationship works and why it's so beneficial for you and your patients is simple. We don't have your overhead and expenses. We don't have to deal with the 100 different things that you do every day. We were specifically built to provide the services that don't pay you well. Or even worse, the services that you lose money on for your valuable time spent. Working with us, you spend less time dealing with the burdens. You have more information and documentation with patients that are more engaged. That means more time spent with these patients providing clinical care, improving patient outcomes and care expenses, while getting paid properly for the care you're providing.